Kids got back to school okay?
Yeah, it's been a fun week.
It's 2 boys, right?
Yeah, the older one started high school. We've already got the call that he's missed class. He couldn't find it.
Oh, seriously?
Yeah.
He just couldn't find the class.
He just couldn't find the class.
And he didn't want to ask.
Yes, and of course he was freaked out that they would know and they would call his parents. And so
Yeah.
that was a good start.
Yeah.
That was a good start.
Yeah, you're being watched, kid.
Yeah.
Here they think or high school, right?
Yeah, a little scared. It's not a bad thing.
No, it's a little pressure underneath them. We're good? Okay, we're getting the thumbs up. Stopwatch. Okay, here we go. So, possibility, you need an antibiotic, or you're looking for an answer to a quick medical question. Maybe you need a referral to a specialist, maybe looking to book in an MRI. It's an honest look at your own health care. And that brings us to today's topic. And we're just going to be skimming the surface on this one. Exec Health. It's a health management company dedicated to providing world-class preventative health care services to incredibly busy people and families. Their goal is to proactively manage their clients' health within the current system, and then also to be able to have like this on-hands approach. They specialize in personal physician services, comprehensive health assessments, diplomatic health, medical concierge services, and of course all the applications of having specialists on board. So that brings us to our topic today in episode 32 of Living Your Life with Leanne Lang. This podcast brought to you by Extension Marketing, and of course for more information you can always head to extensionmarketing.com. It is great to have the president of Exec Health joining us, Sanjay Shah. Great to have you here.
Thanks, Leanne.
Appreciate it. Yeah, I'm really looking forward to this. There's so much information that we're going to be able to cover and to really help people with. And so just, I guess, the overall synopsis before we get going. Can you kind of break down, I tried to do a little intro.
You did a great job.
Yeah, exactly what Exec Health is.
Sure. So Exec Health is a multidisciplinary medical clinic that focuses on proactively keeping people healthy. So, currently, generally the way our system works is first you get sick, then you go to the doctor and you get treated. Our primary role with our clients is making sure they don't get sick in the first place. Above and beyond that, we have a concierge medical practice, both primary care, family doctors, and specialists that provide what we think is a much higher level of care to our clients. And we can get into it, but there's certain processes that we put in place that we feel provides our clients with a really great level of care.
And I think when people are listening or wondering or asking these questions, I think the more educated they are, the more they're realizing that they'd like to be more on the preventative side of their health than of going to the doctor because they're sick. And I think that's the message that we've been trying to kind of really get to people is what you can do, the preventative side, and acknowledging what your base point is.
Right.
And that's something I think that's incredibly important to people. Your base point wasn't starting as president of Exec Health. This has been a long process and a long history within kind of the medical profession or with pharma care. So there's always a story as to kind of how someone ends up where they're at. What was it for you?
Well, you're right. My entire career has been around the medical field. I started off in big pharma. I was in Toronto at the time, and the long and short of it is that my now wife gave me the ultimatum of moving back to Ottawa, which I'm born and raised in Ottawa, and I was happy to do so. But I came to Ottawa and I needed a job. And at that time, we were in a bit of a flux in terms of our medical system. And I took elements from the medical systems from around the world. And I thought to myself that, can we make this work here? There was a concept of concierge medicine in the States. Australia had moved into a dual system, both private, public. And I saw it as a challenge to see whether we could apply it here. From my perspective, looking at it from a 1,000-foot view was that, doctors weren't happy. They were overworked. The compensation was so-so. And I'm talking about primary care here, family doctors, not specialists. And so that side of the equation, doctors weren't that happy with the way things were going. And patients weren't happy. They seemingly weren't getting the level of care they wanted, having trouble getting into appointments. And so I sort of set out to solve a problem that existed.
Bella, your wife, is a physician.
I got firsthand view on what it's like.
I mean, you do have an understanding of what it's like to kind of be under this. You've got appointments, from the start of day to the end of day. I mean, there's situations of wanting to be able to have more time with the client and a patient. I mean, you must have felt that too from
Absolutely.
her and coming home at the end of the day.
Absolutely. So you're right. My wife is a family doctor, and it was on a daily basis. I could see what she was going through, and most family doctors, in fact, 99.9% of family doctors are conscientious, want to do well by their patients, and they're really in medicine to take care of people. Mm-hmm. The problem is, from a process standpoint, is that the system doesn't allow them to take care of their patients to the best of their ability, whether it's the way they're compensated, the volume of patients that they're required to take on. The system isn't set up for optimizing care.
So how much went into understanding what was required or what doctors are doing on a daily basis, and then trying to personalize it or do this concierge kind of system for it, so that you saw that there was a business or a business plan, because you had seen it done in other countries and in other systems, right? And one thing that I'm usually really proud of is being Canadian, and
Absolutely.
especially when I was in school in the States and around a lot of my American friends, was, I was proud of what the Canadian government was able to do, and that I could walk in and go to the doctor, or when I had my children, I wasn't left with an incredible bill. Like I had girlfriends who had babies in the States, and they would be talking about the medical bills, and I was like, I walked in, I had an emergency C-section,
Absolutely.
I left, and I never saw a bill, right? Like there's so many different sides to what our experiences are like.
Absolutely. And it is one of the greatest things about this country is our strong universal health care. And this may sound counterintuitive, but you won't find a bigger proponent to a strong universal healthcare system than me. People don't believe it when I say it, but I absolutely believe that. And I experienced that just recently. My mother passed last year, and she was at the Elizabeth Briere Hospital in palliative care long term. And quite frankly, not just the financial burden that we were spared, but the emotional burden of it. The system is fantastic, and I think we don't take our system for. I think we do take our system for granted quite often, and we'd like to complain about it. But if you're sick, we have world-class physicians. I mean, guys like Mark Riel at the Ottawa Heart Institute, or the Ottawa Heart Institute as a whole, is.
It's amazing.
I mean, we had a client that
it's world renowned. I don't think people
absolutely,
understand the type of work that's actually being done here in the city by our
absolutely,
doctors. Yeah.
and we attract really good people. I mean, people like that can choose a facility, whether it's a Mayo Clinic, they could choose any facility in the world and write their own ticket, but they choose to work here. And so I don't think we should lose sight of that. Having said that, I think we need to continue to work on a solid universal healthcare system that everyone has access to. But there are some challenges. One of them is that we're moving ahead technologically. Science is moving ahead at breakneck speed, and the question is, can we afford to sustain it, and what level will we sustain it at, right? And so, whether it's the CHEO lottery or the Heart Institute Telethon, we're already needing to subsidize these institutions, and so. There's going to be, I think we as a society need to make sure everyone is taken care of at a certain baseline, but there's also additional needs, out there. And do we really want Canadians going to the States or Mexico or elsewhere to get care?
Because we are, right?
We are.
And to be honest with you, I know that my mom couldn't get, it took forever to get an MRI here. And the next thing you knew is I was driving her to Montreal because we could get an appointment, and we were in the next day, right? So, a lot of it is, some people, do you have the means to be able to provide and to have the additional care? And so I appreciate that you say that you're a proponent and a supporter of our base medical, like that. It's an amazing thing that of what we're able to offer, but there are opportunities for people to be able to take their health, preventative health, and treatments to a different level. And I think that's where Exec Health comes into play.
That's right. I think one of the challenges that we've got is that we have an aging population. We have limited resources in terms of number of doctors and the amount that the provinces are able to reimburse them. And so what we've, over the last several decades, I think we've fallen into a situation where, again, it's first you get sick and then you go see the doctor. And we've, I think, strayed away at a primary care level from prevention. So, when was the last time a family doctor had an hour to talk to someone about, a teenager about sexual health or smoking and that kind of thing? Those are all preventive things that, a 14-year-old's not going to listen to their parents about, but they may listen to their doctor about. But unfortunately, that's sort of being bled out of the system. And
there's no time for it.
There's no time for it.
Mm-hmm.
There's no time for it. And, it's not all on the doctor's side. People don't go to the doctor themselves, when they're feeling well, because there's certain barriers to entry. I mean, they don't want to wait in a waiting room for an hour and to get 10 minutes with the doctor.
Okay, so let's take a healthy individual. Mm-hmm. Let's take a really healthy individual who walks into your office and says, I feel good. I think I'm healthy, but I want to see but I realize that there's life ahead and there's illness. And so how do you start with these baseline tests? Let's go through what that first assessment would really be like, hopefully coming in with an individual that feels at the time that that they're doing well. Absolutely.
So, our process starts a couple of days in advance of the appointment. So we have clients come into our clinic. We have them fill out a fairly lengthy medical and lifestyle history questionnaire, because it's not all about diagnostics and medical tests. Your family history is a big indicator on your future health. We do a full battery of blood work.
Hold on. I'm gonna itemize these. So this is a lengthy questionnaire.
18 pages.
So you need to be armed with some knowledge of understanding your family history a little bit, asking questions.
It's interesting. What's interesting, I've been doing this a long time now, is that it's amazing to me how many people don't know their family medical history. And when you've got a document in front of you asking, what did Uncle Joe die of,
mm-hmm.
And what age did he die of? It actually begets conversations within the family in order to fill out these questionnaires. And for many of our clients, it's the very first time they've documented their family history, and it's very powerful. It's an additional diagnostic tool for our doctors to use.
I would think sometimes they're surprised.
Of course they're surprised.
Or then they see between generation from grandfather to father, that there is a link, or that they weren't maybe made aware of.
Yeah. Oftentimes people know that a family member died in their 40s, but they don't know whether it was cancer or heart disease. Mm-hmm. And especially with our, we're a country of immigrants. A lot of that history, certainly in my case, I don't know my family history because it was lost when my parents came over, and there wasn't any way to retrieve it.
18 pages.
It goes pretty quick.
I know, but I'm thinking, like, be open to the questions that you're going to be answering, and be open to having that conversation with family, because it's generational.
Absolutely.
Okay, so that would be one of the first things that you do.
That's right. And it also lets the doctors focus in on the most important parts of when the history's done in advance, it lets the doctors focus in on the important parts. So we do the history, blood work, urinalysis, and then we do all that in advance, so the doctors have got the information in hand at the time of the appointment. That way, if something's even approaching offside, they can have a meaningful discussion with the client.
Okay, so before they're actually coming into the office, though, that questionnaire and that blood work is done.
And in the doctor's hands.
What can I ask through that blood work? How much are you testing? Like, how, oftentimes I see my doctor do like 3 check marks on this list. What check marks are going into this?
Yeah, so we do, it's very lengthy. We do everything from cholesterol panels to iron to thyroid to glucose. So it's everything we do is evidence based. So we don't do unnecessary testing. But it's a pretty lengthy panel. It's probably about 20 tests, I would think.
That's coming through the blood.
Yeah.
So you have the questionnaire and the blood assessments done, results in hand. So when you're first in that office, the doctor's already been able to look over the
They already have a
chart.
Sense of your issues or potential issues,
mm-hmm.
Yes.
Okay, so then you get in.
Then you get in.
Yeah.
And then hopefully you've had a good breakfast because you're there for 4 hours. And during the course of the 4 hours, we start with an hour with our nurse who does a number of diagnostic tests. So we test your hearing, your sight, your lung function, your heart, the circulation in your body. And so our whole intention is to pick up on small issues before they become larger
mm-hmm.
problems. So that's so there's a full hour of diagnostic testing. Then there's an hour with our physician. Sorry, go ahead.
Yeah, okay. So, but I'm just thinking, I would have had to make an appointment for the eye doctor.
Yeah.
to look at, right? Like, so you're thinking about all of these different tests that you're doing, hearing, sight.
It's a one-stop shop, really.
Right, because, sometimes you're having to go to the eye doctor and go do this. So you have, it's all on.
Yeah, for clarity, we do eye testing, but it doesn't replace a visit to an optometrist every 2 years. We don't dilate the pupils, for example. So but those are part of the recommendations. If someone hasn't seen an eye doctor in a couple of years, we would still recommend they go see an
So if you're filling out that questionnaire saying when was the
That's
last time you saw an
optometrist,
one of the recommendations from the doctor will be, all right, we need to get this more up to date.
That's
okay,
right.
But it's part of the baseline testing of that first.
That's right.
Okay.
So we do a basic eye test where we look for color blindness and nearsightedness, farsightedness, but we will not fit for prescription for glasses. That's clearly in the realm of an optometrist. So we do the diagnostic test, and we book an hour that morning with a physician. So for most people, an hour is sufficient amount of time for a physical exam and review of the results. But if it's not, then we would just book a follow-up appointment with that patient. We don't want time to be a constraint with these examinations. So it's not unusual for us to book a follow-up, but we book an hour that morning in order to stay on time. So there's an hour with the nurse, an hour with the doctor. Then there's an hour with our physiotherapist. Our physiotherapist looks at joint stability, range of motion, spine alignment, does a fitness test, both cardiovascular and strength, that's benchmarked to the client's age and gender.
Okay, so you're bringing running shoes,
yep.
And
you're on a treadmill. Yeah.
Are you doing the
VO2 max?
Yeah.
No, we do something called a suboptimal VO2 max. The VO2 max is predominantly for athletes and usually done in a university setting. So, most of our clients, typically aren't high performance athletes.
No, but it's likely for them probably the first time that they're doing a test like this.
Yeah, we had a client actually that he's got a testimony on our website. It was quite a story, but he'd had his annual physical with his family doctor, who I've known for 20 years. Terrific doctor. I'd hire her in a second, but we had just signed up his company with this new benefit where they would send in their executives for these 4-hour assessments. So clean bill of health 3 weeks earlier, he came in to our clinic and got up on the treadmill, and his heart rate was not dropping. So we arranged for him to go to the Ottawa Cardiovascular Center that afternoon. And long story short, he went straight from us to triple bypass surgery. 2 of his arteries were 97 and 98% blocked, and but he had no overt symptoms. The family doctor had nothing, no reason to suspect that. And I was having a conversation with one of the cardiologists at the Heart Institute about what new technology could we bring on board at a primary care level, and this guy's got a Scottish accent, and his Scottish accent said, all the stuff they do in the States is crap. I think he was being a bit facetious. He said, primarily it's risk management, and he said, you've got heart disease, I've got heart disease. It's a matter of managing those aspects that we can manage, whether it's weight or cholesterol, that kind of thing.
You had this patient come in to do this test. What would have happened had you not been able to put him through a little bit of exercise to realize that his heart rate wasn't dropping?
Yeah.
To realize you need to go to the doctor immediately.
That's a $1 million question. Right, he may very well have been one staircase away from, disaster.
It's scary.
It is scary. Yeah.
My dad died. He had just turned 57 the day before of a massive heart attack out golfing, and it was one of those, and it stayed with me as to, I didn't know, like there were, when could it have occurred? What could we have done prior to? And it was interesting when I went through some of his stuff. I saw a lot of Tums, and I think he just always thought he had heartburn.
Yeah.
And I look at like the packages of Tums that were sitting there, kind of going, he might have had all these little one, like the symptoms, little like that. Signs, there were signs, and so you look at this individual who. I wish my dad had had the opportunity to go to the Heart Institute, that one of those signs would have led us to that. But that this gentleman, in a split second, his life changed drastically from coming in to do this checkup to being there. So are most people able to get through, like, do they think they're in better shape when they get on that treadmill? Or sometimes are they surprised that the morning walks that they've been taking have been beneficial?
Yeah.
Like, what's the reaction from people when they're faced with the reality of their health?
It's a good question. It's very individual. We have some lawyers at a law firm that we do business with, and they come in and it's a competition for that, right? So they may
imagine that
they may be unhealthy for 8 months of the year, but leading up to their physicals, what they book all around the same time, they start getting in shape, which I wouldn't recommend. It'd be. We tell them, this is a long game. It's 12 months a year, but they are who they are, and so it really is individual. It's a real wake up call for some people. I remember we had one gentleman, and he came in for his first physical, and a year later, he walked in and he was quite literally half the man he used to be. I mean, I didn't recognize him, and he said. I just implemented the result of the recommendations that you guys gave me a year ago. It was predominantly diet, and the guy travels a lot, eating out of airports, but he was highly motivated to do so. Others, to be quite frank and honest, will opt out of the dietitian year after year because they're just not willing to make that change.
Are you able to take the guy who came in as half of himself saying, I took the recommendations and I did what I was supposed to do, and kind of have him plastered all over the outfit? It's amazing the power of what happens when you have a motivated individual who looks at these results and can say, I can do better.
And that's one thing I will say. Most of our clients, they're paying a membership to be a part of the clinic, and so they are invested in their health. So we kind of skew towards people who are there for a reason. Either they've got an existing medical issue that needs managed or is not being managed adequately from their perspective. And I should say, we oftentimes will turn away patients because their family doctor is managing things perfectly, and they're just looking for something that we can't provide them. They are. There's no magic bullet out there. And as I said, most family doctors do a terrific job, right? And so, but our clients are, first of all, they're spending 4 hours out of their day, and if you're a lawyer and billing out at a certain amount of time, that's a significant investment, not only in time but in financially.
Yeah.
And so most of our clients are invested in their health. So it's kind of a nice practice to have that from that perspective.
How many years now has Exec Health been?
We started in 2005. We started doing just the 4-hour assessments, the comprehensive health assessments, primarily for companies, and so from that organically, we'd have people saying that I get this great physical once a year, but either I don't have a family doctor or I'm not getting great care those other 364 days of the year. So from that grew our concierge practice, so
what do you mean by the concierge practice?
So it's a full scope family practice, and we last year hired the former chief of internal medicine from the Ottawa Hospital to come on board to provide specialty care. And so it's a family practice with a slightly different model in the sense that generally speaking, most family practices are volume-based. Their family doctors typically will see a patient every 10 minutes, so 6 to 8 patients an hour. I say 6 to 8 patients an hour because I recently found out about a clinic that's now booking at 7 minutes per appointment.
Oh my God.
And so, but the incentive is for volume. Even with the new family health teams, the doctors are compensated on the size of their practice. So it's not unusual for a physician to have 1,500 patients. I know of at least 2 physicians that have 3,500 patients under their care. And so,
is it because they're that good, or is it because? How does an average around 1,500, which is still a big amount, and then that you can go up as high as 3,500? You're never getting in. This podcast is brought to you by Extension Marketing. They are a new breed of marketing agency that acts as your virtual marketing department, designing and implementing cost-effective marketing strategies that will grow your business. I can speak to this personally, as I've been using the Extension Marketing team to help me launch and grow my business. Founder Pat Whalen has been a lifesaver for me, a genuine coach, guiding me along the way into uncharted territory. Tell them you're a friend of the show and receive a free 1-hour consultation. Check them out at extensionmarketing.com. How do you get in?
It's a good question. I mean, the the new family health teams, family health organizations are on what's called a capitation system. So meaning that the doctors get a flat rate of roughly $110 per patient per year, regardless of how many visits. Now there's certain bonuses built in, et cetera, but that's sort of their base. Okay. So again, the incentive is to have, the larger the practice you have, the more income you're going to have. And then it's up to the individual clinic to manage that workflow. And so, I don't know. I don't run one of those organizations, so I imagine it's quite a challenge. At our clinic, we keep a ratio of 1 to 200, and it's usually running less than 1 to 200 because when you guarantee your patients same day appointments and being on time, you can't let the practice get too full before you hire another doctor. Above and beyond that, medicine's becoming very specialized. Well, when I say specialized, it's as I've said earlier, knowledge is moving forward at a fast pace. Technology is moving forward at a fast pace. So, my personal view is that the days of the generalist are long gone in the sense that the physicians that we hire all have additional training. They're family doctors, but we have fellowships in women's health and dermatology and integrative medicine, and we have a travel medicine doctor. Any doctor can do travel medicine, but are they in fact a International Society of Travel Medicine doctor certified physician that actually goes to the conferences?
Right. So when you have these executives that are needing to travel for business ventures to these interesting places, there's someone even within the office that's able to say, okay, well, you're going to, you're going here, you're going to need
China,
this.
Africa, India, a lot going to India these days.
I asked you when you guys started because you said back in 2005, right? So my thought when I asked that question was you've had people that came in with baseline testing done back in 2005, right? So it's now been 13 years. Have you seen or have you had opportunities where these baselines that you started with over the years we were able to monitor and see baselines changing and have then where the preventative side of things has been able to kick in to see that there's things are going off the rail.
Yeah. So the we traditionally have diagnosed found undiagnosed issues in about 30% of the patients that come through. Some of them are minor, some of them are major, like the gentleman that had needed bypass surgery, and we do track. Each of our patients receives a report year over year report, and so we track things. And the more important part is that when they first come in, we have a baseline, and then once things start. We haven't found the cure for aging yet, so things eventually will start to go off the rails. So it's our job to make sure that once the numbers start skewing a bit, that we take preventive action. There's some things that we can do, and there's some things that we can't do. Right?
What can you do?
Well, the big ones for us are finding cancers early. There's some cancers that are very slow moving that if caught early, the prognosis is great. There's some cancers that are not, and there's certain diseases that we just have no control over. But a lot of lifestyle modification, managing cholesterol there's the big and. These questions are, I should say, I'm not a physician, so not to be construed as medical advice, but as a layperson, we manage cholesterol. Blood pressure is a big one in the sense that they call it the silent killer for a reason. You don't feel it, but it can lead to cardiovascular disease. Diabetes is another one. Just a few weeks ago, we had a guy in his 30s that we diagnosed with diabetes, a very unusual case, and not type 1 diabetes, of course, but everyone, including the physicians, were a little surprised that this young guy had diabetes.
But when you're coming in at the age of 30 and you discover that you do, and it probably
would have been something
being
managed,
right? So then you're giving this person a chance to get on it much earlier than probably they would have thought to look into this. Yeah.
So he will be much healthier for having had it diagnosed early and treated appropriately.
You look at these. So then I ask you, if you're seeing these baselines and you're seeing a shift, or as you were talking about, being able to diagnose cancers earlier, what then happens? Is there access from within your organization to these specialists? Like how does this then benefit by
Yeah.
being a member and being involved in this?
It's a great question. So the first part is early diagnosis, right? And so once we find something wrong, then we kick it into high gear, in the sense that we have staff, our medical concierges that work to expedite surgeries, MRI, specialist appointments. We don't have any preferential access, so there's no queue jumping. We can't bump someone from the MRI machine at the Ottawa hospital. But like your experience, we can arrange for an MRI just in Gatineau. And that's another interesting thing is that even within our borders of Canada, there are private options right across the board.
So usually then it would come at an additional cost, but at least
But we are quarterbacking is what we're doing, and by keeping a small practice size, we've got the shelf space to go to bat for our clients. So, we first try to expedite through the public system, and anyone can do it either for themselves or their physician, if they had more time, could do it. And that means like calling multiple specialists, calling multiple facilities, looking for cancellations, that kind of thing. And so that's the concierge part of it. And if we can't expedite through the public system, then we're set up on the private side, whether it's in another province or another country even.
Okay, I'm gonna get to this question because I want people
Sure.
to realize when you're talking about this sounds, oh my gosh, I want in. What is a cost? Like typically, and there are not many organizations. There are some, but
Yeah.
what would be the cost? Because I think you had mentioned like you work with companies, and this is almost like an executive help, right? Like it can almost be part of their bonus structure or their incentive programs to come to this company, and we offer you this. Like realistically, what is the cost for something like this?
It's interesting you say that because that's the way we started was with companies, but over the last 5 years, the majority of our growth has just been individuals signing up. So it used to be executive help, just executives,
Right.
but now it's quite a cross section. And the cost of the comprehensive health assessment is $15.95. None of it's charged to OHIP, and so that includes all the blood work, etc. Our ongoing care program, which includes the annual physical, is $3,200 a year.
So
$300 a month.
okay, so it's almost like a monthly. It's like almost if you look at it like a monthly membership, and
Correct.
then okay, but this monthly membership then gets you in for getting in to see a doctor. Like, what comes with that then?
So includes your preventive health exams.
Yeah.
So we see each one of our clients. Well, we can't make them come in, but we book them in every year for their preventive health exam. And then what it includes is guaranteed same day or next day appointments. If someone calls at 5 o'clock in the afternoon, it might be tough to get them in, but generally it's same day appointments. We're always on time, so we never keep people waiting for an hour in the waiting room. But more importantly, by keeping the small practice size, we free up the doctors to spend as much time with each patient as is required. So, if someone's got multiple issues, there isn't a sign that says one issue per visit. If someone's got a mental health issue and needs an hour with the doctor, we've got a number of patients that it just says on their chart, book 1 hour for each visit. There's access to the concierge service. There's telephone consultations. And then above and beyond that, which is not included in the fee, is that we've got other medical staff because again, medicine's getting much more complicated, and so we've got on-site physiotherapists, dietitians. We have a Harvard PhD psychologist who's fantastic, and so
That's a new addition.
That is a new addition.
I know addition. It's a fantastic addition. Yeah,
she's been great,
Yeah.
and what's interesting is that being in the clinic in my office is what I see these people talking to each other in the hallway, and I think that's another challenge in the public system is it's very siloed. So when you go see your physiotherapist, are they having a conversation with your family doctor, and are they collaborating? And generally speaking, I would say no. I won't say it doesn't happen, but it's not happening for every patient. Whereas our physiotherapist will walk down the hall, talk to the doctor, and say, such and so-and-so's got this knee problem. Are you planning on starting an NSAID, or I think probably we should try this manipulation first, that kind of thing.
How many then are on staff? Like how many doctors are on site? Like how many people do you have working in this environment?
Yeah, so we've got currently 5 doctors, 5 family doctors, 1 internal medicine specialist, 2 physiotherapists, 3 dietitians, and a psychologist, and the support staff behind them as well.
Right. The ones that are doing those phone calls in that concierge.
The ones that are doing the heavy lifting.
Yeah.
Yes. Yeah.
You know, when you think about when you listed what's being done, there's some heavy lifters behind the scenes that are getting
a lot
it.
of available grease.
You know what? I'm gonna say, when you look at it like $300 a month, it's much more digestible.
Well, I
am I allowed to say that? You know, like because I'm saying for some people they'll be able to afford this. For other people, you know, there's ways, and hopefully you're listening to this on how to kind of beat the system a little bit and kind of following up on cancellations and making calls to a number of different, you know, clinics. But it's not as bad as I anticipated.
We had one, I probably shouldn't say this, but I had one client say she spends more on her hair and nails in a month.
Well, I'm thinking there's a bit of that. Like I was actually expecting when you were listing all this for it to be an astronomical number that I was going to kind of go, okay, most people, you know, you hear Exec, you hear comprehensive, you know, you start to kind of back away a little bit.
Sure.
But when you did think about that, like, you know,
we had
hair, nail, you know, or anything else, it's like, where are you making your investment? If you're investing in the personal trainer and you're investing in all of these other things that, you know, the preventative side of things, of really being on top of your health, this is a wise investment.
And that was part of the plan always, was trying to make it as accessible as possible while still, you know, being able to turn on the lights. And so, you know, I had one of our clients is a business owner that moved up from the States, and he was paying $25,000 a year just in premiums. And
with their health insurance in the States.
With the health insurance in the States. And he was urging me to raise my prices because as a business owner, he's looking at the dollars and cents. But we never really set this up to maximize the dollars. I mean, we really are in it to take care of people. And so, could we raise our prices? Probably, but do we want to? No.
So there's some people I think right now that are kind of making a checklist going, okay, can we figure this out? Can we make this work? Especially to understand that it's not just now available for high-end executives at these big companies who are offering this out, that it's the general public has access. And is it better when you see a family? You know, like I'm looking at it now and I have, you know, Andy's, we're starting to have women issues, right? Like, is it best that still family concept is important?
Absolutely, it is. And
I saw on your you have teen programs and stuff. Like, if you look at the website, it's a part of your breakdown.
It is, and we've got teen mental health right now is a big thing for us. We've got a lot, especially with Dr. Siegel coming on as a psychologist. It's amazing how many kids are struggling. I mean, you and I are, prior to the podcast, we're talking about social media, and it's tougher being a kid. And so, we actually don't charge for kids under the age of 25 if the parents or adults enroll in the practice. And so, it's. As I like
that's under 25. I thought you were going to say like under 12 and the kids come in. Like that's a big gift right there.
Well, you know, I won't say that we're inexpensive. I mean, it's expensive to run a kind of business that we run. So but you're right. The taking care of the family unit is so much more fulfilling for us in the sense that you get insights into that help you with each family member, because although there's confidentiality amongst family members, it helps you provide better care when you know what's happening with the whole. And the nice thing is that, as I tell my staff, our clinic, medicine typically in Canada is set up on a transactional basis. You know, it's sort of get them in, get them out. We need to see 6 patients an hour, that kind of thing.
And you better have that card with you when you.
And you better have that card.
You better have that card. Yeah.
For us, I tell my staff almost on a weekly basis that we are in a relationship business and we want to develop these long-term relationships with clients. We having been in business for 14 years now, we've seen some of these kids grow, and they're off to university, and they call us and they talk to the doctors on the telephone. We've managed an eating disorder out at a university out east that from our perspective we didn't feel like was being handled appropriately by the on-campus medical clinic that just wasn't set up to do that. So it's a lot of elbow grease, but we feel emotionally invested with our clients.
Right, and you've seen this child, right? Like it's
grow up,
right?
But that's not different than any family doctor, quite frankly.
Yeah.
If you've seen someone grow up, you want to do best by them.
No, absolutely. Gosh, I still go and hug my family, my pediatrician.
Yeah, absolutely.
You know, there's a relationship that's definitely established there. Okay, I want to twist this on you a little bit. I hope you don't mind, but you know, for some people, I think there's a deep consideration like this is an investment worthwhile. There are and large population people can't afford this, right?
Sure.
We're lucky here that we have what we do have, that we can go in and have babies and have surgeries and be able to walk in and not be left with a massive phone bill, with a massive medical bill. What tips can you offer for people who are fighting the system, are trying to get an appointment, are trying to do things? What would you suggest to them as to their best strategy to help them maneuver the system?
So there's a couple of things. One of them is getting back to what I'd said earlier. Most family doctors are there to take care of their patients, and are very conscientious. They're well trained, so most people are in good hands. They are in good hands. Having said that, the family doctors face a lot of pressures, and mostly time pressures. And so one thing is you do have to be your own advocate in the system. Absolutely. And so as much as most doctors malign Dr. Google, we're in an information age where you can go and educate yourself and have a meaningful conversation with your doctor while you're in there. And then, it's if you're completely out to lunch in terms of what you think is going on, they're the expert. They can tell you, there's probably a better modality. We don't need to do an MRI. We can do an ultrasound, or, I think this is what it is. And, you're the consumer of... You are the consumer. You're the client. Sometimes we defer to doctors, and again, medicine is getting much more complicated. So I wouldn't assume that the physician has the answer right away. Don't be afraid to ask the questions. And if you or the physician are unsure, it's not unreasonable to ask for a referral to a specialist. And
okay,
go ahead.
You just said that, and now I'm going to say, and then in 6 months, you'll get in. So
I'll give you a little tip.
Okay.
So there are, whether it's a specialist or or imaging such as ultrasound, MRI, there are ways to get things done more quickly. It takes a bit of elbow grease. So I would ask the family physician for a copy of the referral. The family physician will make the referral anyways to whom they feel would be appropriate. But there's nothing preventing you from calling other specialists, whether it's a gastroenterologist or endocrinologist, and asking if they've got cancellations. And with the referral in hand, you can just fax it over or bring it with you. The specialists do need the referral. So that's one thing that you can do for yourself is, do your own legwork. Your family doctor will not have time to do that for you. And they will be more than happy to, if you found a better appointment, to either fax over the referral, but it's a lot easier.
It's good to have it in your hand.
In your hand.
As you're leaving, knowing that you have a referral in the works, that have a copy of it and have it on
Absolutely.
hand.
If you're willing to do the legwork. Ultrasounds there in this city, there's a number of ultrasound clinics you can go to. So if Maribel Medical Imaging is having a lengthy wait time, Sound Care may have a cancellation tomorrow. So that's something that you can do for yourself. That's something we have our staff do on behalf of our clients, but it's absolutely something you can do yourself. The other thing is that look at your caregiver, and this is not just physicians. Look at your caregiver's credentials. Are they the right person to diagnose and or treat what ails you? And so as I said earlier, any physician can kind of look up the CDC website for what vaccines you need to go to the Dominican Republic. But if you're going somewhere a bit more exotic, I would go to a proper travel medicine clinic and pick the right provider. Above and beyond that, we find with a lot of our clients, it's they're going to a lot more naturopathic doctors, chiropractors, alternative therapies, and there's quite a wide range of quality out there. So do your due diligence. If you can get a referral from someone who's been there before, I'm not a big fan of online rating systems in the sense that it's most doctors will have terrible rating systems because it's only the people that are dissatisfied that typically go on these websites. But try to do some due diligence. Do you know the difference between a registered dietitian and a nutritionist? Which is the best for you? Those are all things. Again, you've got to be your own advocate and take responsibility.
There's difference in degrees in schooling, and
absolutely.
Absolutely. I've had a number of naturopathic doctors on, and I've had Kent McLeod from NutriChem on the kind of deep prescribing.
Yeah.
I find it's so interesting. Maybe it's just because I'm fascinated by it, right?
It is interesting.
Of how people can view their health and the changes that they can be made, and so many different perspectives of how to approach medicine.
Absolutely. One of the things that, and this is more of a personal editorial, if you will, but one thing I find is a bit of a red flag is if someone's recommending something to you and also selling it to you. That that's something that we don't do. I mean, if one of our doctors is going to recommend omega-3 fish oils or vitamin D, we won't be selling it to our clients. So just be a savvy consumer and there's nothing wrong with being forceful as well.
Mm-hmm. Do you agree with a lot of the intake, though, that, you can do the blood test and you're iron deficient and you're like that? There are sometimes it's not as complicated as people think it is as to what might be ailing them.
Absolutely.
And there are ways to be able to fix the situation.
I'm not a medical doctor, but I've seen people's lives turned around because they've been diagnosed with hypothyroidism, and it's a simple medication that they're on, and the medication, it completely changes their lives. Absolutely. It can be simple. Absolutely.
Sometimes it can be really simple. The other things that I noticed through you, I guess maybe because we live in Ottawa, we live in the nation's capital, but you have a lot of traveling diplomats. You have a lot of people that are coming in from different areas who this is a new introduction to the system, right? But who are living here, who have families. That has to have been an interesting part of it.
Yeah, that actually happened organically. We never really approached the diplomatic community, and they found out about us and approached us about taking care of their staff. And as a Canadian or an Ontarian has been living in the province their entire life, if you don't have a family doctor, it's hard to find a family doctor. So imagine being a diplomat that's posted here for 4 years and coming with your entire family. So that's it's something that we've embraced and we've kind of scaled up, and it's fascinating. What I find most fascinating is talking to them about their medical systems.
Yeah, I was going to say how crazy stories do you have?
And I've got a lot of crazy stories, of course, but can't share them with you. But the more fascinating thing is how well regarded Canada is as a brand, if you will, or as a country. And so again, we get down on our medical system and our doctors, but they really are world class. And so hearing some of the stories from other countries, even seemingly developed countries, we don't have it too bad here.
Yeah, they probably come and experience it.
And then they send their families to us.
It's a very different experience.
So we become a
for
destination here for international medical tourism, which again is which is kind of counterintuitive.
Yeah, absolutely. When you think about it, plastic surgery, all that kind of stuff. That is, I'm shaking my head, but you're saying yes. Is that?
Sorry, I'm not.
Like, is that part of the cosmetic, what's the word I'm looking for? The optional kind of things.
Yeah.
Is that something that you stress, or that's really not the main? So
we're predominantly a medical clinic. We don't do any cosmetics, but our clients count on us for referrals and making sure that they're going to the best people in town. I mean, whether it's cosmetics or shoulder surgery, there's probably only a couple of shoulder surgeons that I would want personally operating on my on me if it was my shoulder. And so, and there's other surgeries that it doesn't really matter who operates. So we take great care in who we refer to.
Is it just based on relationships? Is it based on success? Like it's mostly, how does one get a reputation of being just that good?
Yeah, it's a bit.
But you got to get in to see this doctor.
Yeah, it's a good question. So it's for us, it's never relationship; it's all reputation, and so we will.
Because there are some great doctors with horrible bedside manners.
Yeah.
Right. So it's not
and
necessarily.
those are the ones you still want operating on you.
Yeah.
Well, yeah, I
You
say
do.
that,
They're just good at what they do.
yeah. So yes, it's absolutely true what you're saying. But if the question is, why are you going there? Are you going there because he or she is a top heart surgeon, but they got the mouth of a sailor? I'm okay. I could live with that. If you're going for cosmetics even cosmetics, there's good and bad out there.
Mm-hmm.
So
But for you, it's based on reputation, the work, not the relationship.
Definitely not the relationship.
Mm-hmm.
We never. Once a patient signs up at Exec Health, we will always do what's in their best interest, financially, medically, personally. So our job is to take care of our clients. So we will not refer to many physicians. I shouldn't say many. There's some physicians we will not refer to, only because there's better ones out there.
Mm-hmm. It's really politically well stated. Did we say that right?
In some cases, it doesn't matter, though, right? I mean, if you're going for something fairly standard, and then we'll look for the quicker appointment. But we'll give the patients the option, saying, if you really want, this top surgeon, the wait time's going to be 18 months, and there's nothing we can do about it. Or, here's the 2 or 3 other options.
Mm-hmm. But there's that reality right there. It could be 18 months.
It could be 18 months.
And it doesn't matter if you're in the system or it just is. That is the reality that we face.
We can control what we do within our 4 walls. So we can guarantee our clients same-day appointments, but we can't control, what's happening, out in the public system.
Is it that we need... Where's your solution for that? Do we need more doctors? Do we need to entice more doctors to stay?
We have more doctors than we're using, believe it or not. So I was approached maybe a year ago by a gynecological oncologist. Yeah, Canadian trained, Canadian born, Canadian trained, and was moving to Ottawa because her partner's here, and she can't work because there's no OR time. And actually, the ORs are empty, but there isn't funding for her to go in and do surgery. And
so a good doctor, trained, wanting to take on patients, license available, just happened to be a move of destination.
Mm-hmm. And there's a number of people ahead of her that will get OR time before she will. So,
but the OR is there.
The OR is there with
its equipment.
Nurses waiting on the sidelines, and
we can't get in
because. Again, driven by provincial budgets, in the sense that there's only so many surgeries per year that will be funded. So there's a urologist that's traveling to Cornwall that can only find OR time to work in Cornwall, and so they're picking up the scraps, kind of thing, until somebody retires or moves on.
It's interesting though, because I always thought it was maybe a lack of doctors wanting to stay within our borders, but that isn't necessarily
depends on the specialty.
Case.
I'm talking surgery here particularly.
Right, but there are good people.
There's good people
with the availability to do it, and yet that's where the government system is.
On the primary care side, I think there is a shortage. Yeah. I don't have the
numbers. Like we were joking, it's hard to find a family doctor if you haven't been born into it, right?
That's right.
But on that other side.
Yeah, I think it's a dirty little secret that we don't talk about too much. And I'd read several months ago that some of these ORs are being used for cosmetic surgery as well, because even though they've got surgeons that are able and available to do the necessary surgeries, the funding had run out, and so the ORs.
So now the ORs are being used by those that are just paying clients for cosmetic.
Yeah. I don't think it's a large proportion, but there was an article in the National Post about that. Yeah.
It's interesting.
Because, again, it gets back to our original conversation around, we have a great system, but we have limitations in what we can afford to do.
So what happens then if you have more people coming in and you wanted to keep it at the 1 to 200? How does your business structure then work? Because I think as time progresses and people become more aware of having to be their own they've got to be their own force, I think.
Yeah.
And that's what I think we're trying to educate people on is you really do have to take control of your own health and the preventative health aspect. Can you continue to grow? Are there going to be more services like this popping up, realizing that this is where possibly the system is going?
Absolutely. Well, I think there would be, and there already has been. But for us, it's we can continue to grow. I mean, we're an attractive place to work for a family doctor in the sense that the volume is lower, the quality of interaction is better. So, as I said, we book a minimum 30 minutes for just a regular primary care appointment. I mean, you can barely say hello and how's the family before 10 minutes is up, right? And so, but if someone needs an hour, we book an hour, and so that's nice. They don't have the time constraint on them. We book off time for paperwork. We allow them to eat lunch, bathroom breaks, things that most family doctors
which
don't
I'm
have.
looking at with one doctor that you mentioned was in every 7 minutes.
Yeah.
I'm like, they're not eating, they're not going to the bathroom. Like
clinic,
you think about, and you feel for them too, because they're trying to do their best and be the best doctor they can be.
Absolutely,
and yet this is the circumstance that they're under. I thought this was really interesting, and I do appreciate you kind of giving tips for people to be able to kind of take some of those medical charts and medical history and appointments and figure out a way that they're able to do some of that themselves as well. Where can people find more information? The website's got a lot. There's a lot of different programs and assessments and things that are available, but definitely something that people are, I think, opening up their mind to what really is actually out there. And so Exec Health is the best way. Just go to the website, look for some information.
I think that's the best. Yeah.
Great chatting. Thank you so much.
It's my pleasure. Thank you for the invitation.
No, I think I'm becoming more fascinated as the world is opening up a little bit more to me. I'm realizing how many programs are really out there and what is available to people if they just actually listen and open up their mind to taking responsibility.
Absolutely.
Yeah.
That starts at home.
Yeah. And I like the guy that came in, had his assessment, and came in then a year later and was a different person.
Those
are great stories.
Yeah.
Those are really great stories. As always, too, if you're liking the stories here, if you're enjoying the podcast, did I mention, I think we reached Qatar. So hello to whoever you are from Qatar who's now listening. It's been so much fun seeing just how it's crossing oceans and the places that this podcast is getting to. If you like it, please tell people, subscribe, share it. It's really great to see this podcast growing. And that's it. That is a wrap on episode 32 of Living Your Life. Sanjay, thank you so much, and we'll see you back here next week, everyone. Thanks a lot.
Thanks, Leanne. That was fun.